Pat and Aaron Show, 95.3 WDA and AM 620. Time for the Injury Report. And the Pat and Aaron Show Injury Report brought to you by Tampa General Hospital in partnership with Florida Orthopaedic Institute. And we bring on once again one of our favorites, Dr. Jeff Sellman. Dr. Sellman, thank you for joining us again this week. How you doing?
Oh, I'm doing awesome. And don't forget, you can't say favorites.
We're not allowed to pick favorites?
You're not supposed to. I'd be betting.
We do everything wrong on this show, Doctor.
Which is why I'm here, or why.
We need your help. And Dak Prescott, everything was going wrong for him against the Buccaneers in Week 1, and it ended poorly as well when he hurt his right thumb, had to undergo surgery. Now, if you listen to Jerry Jones says he'll be back in less than 4 weeks. If you listen to the doctors, they're saying it's more like 6 to 8 weeks. What are you thinking, Dr. Sellman?
I'm going to give them the 6 to 8 weeks. Jerry really wants him back within the 4 games, being off not even on the injured reserve yet. But the good thing about this particular injury is that the fracture happened away from a joint space. He will be able to move that thumb a little bit sooner, especially when they get the hardware and the plates in there. My bet, though, is because that thumb normally is quite flexible, he's going to lose some of that mobility, which is very important for his throwing hand, and it's going to take a good 6 to 8 weeks for him to come back.
We saw that safety Jamal Adams of the Seahawks was carted off during Monday night's game, and apparently it's an injury to his left quadricep tendon. What does that injury look like? How difficult is it to recover from? I feel like muscles like that you're constantly using when just doing anything like walking, bending over, like how difficult is that to recover from?
Man, I tell you, that's pretty rough, and you're absolutely right. Getting up and down off the toilet, which I hope we do every day, would be hard to do if you don't have your tendon completely intact. And him needing surgery, my assumption is that he likely completely tore it or he ruptured that quadriceps tendon, which when you look down at your leg when that happens, that kneecap actually slides downward a lot further than the other one. Certainly takes quite a bit of force, but that's going to take quite a bit of rehab after he's immobilized for up to 6 weeks.
You really painted that picture for us, Dr. Sellman. The kneecap
Man,
falling.
Don't you love that?
Oof, that's
what's
rough.
What's the weirdest injury or most horrific injury? Like, where's maybe the most misplaced part of a body that you've seen?
Have you ever had to look away?
Wait, during the medical part or something else at home?
Yes.
Yes, I would have to look away when I saw just the actual dislocation of an ankle, and then the bones were coming through it. I was like, I do love this crap, but I can't look at this one. This poor guy.
What's the most maybe out of place bone or joint or like something misplaced where it's not where it's supposed to be that you've seen?
Oh, do you remember that? Gosh, I forget his name now, but I was doing my training at the University of South Carolina. The South Carolina, Lattimore went down on the field with a complete. When you hear somebody say, "Oh, I had a knee dislocation," and they're the South Tampa Weekend Warriors, that means the kneecap just went out and came back in. This poor guy had his entire knee, the big bone femur, displaced from the tibia, and it was all of us were a little bit sick when we saw that. So that was the most out-of-place joint that I've ever seen.
T.J. Watt of the Steelers, the reigning Defensive Player of the Year, he's going to get a couple different medical opinions because he's got that torn pectoral. If he needs surgery, what does this mean? Is his season over? What's it like trying to recover from a torn pectoral muscle?
Yeah, here's the perfect example of you get 6 doctors in a room, you get 8 different opinions. So it's always a great idea if surgery is anywhere on the table that you get several different opinions. Last time I read, he probably did not have a full tendon tear, which normally requires the surgery, and that the recommendation is not to have it. So that would mean he likely had some partial tearing of the muscle fibers actually in the belly itself, kind of around the nipple area or the shoulder area. Yeah, sounds good, doesn't it? if he were to have surgery, he's going to be out for probably the rest of the season. Non-operatively, he's going to be back mid-October if he does not need surgery.
So Donovan Smith has a hyperextended right elbow, and apparently his availability is going to be dictated by his pain tolerance, which I think is good news because we've seen Donovan play through some things before. What does the pain feel like for an injury like that, and is there risk? It sounds like maybe they're saying there isn't, right? Is there risk to a re-injury if it's just a pain tolerance thing?
Well, anytime that any joint goes out more than it needs to go, you're going to have a little bit more laxity / stretching of the tendons and ligaments and muscles around it. So there is a possibility of a little bit of an increased risk for injury. But, man, Donovan Smith, he's only missed 2 starts, so his pain tolerance is going to be really high. For us, we're not going to be able to lift a can of beer after this because the pain is going to be in what I love to call the elbow pit, that area where they put the needle in to draw blood. It's going to be really tender to touch to straighten. It's going to be really stiff in that area, too.
That's what I wanted to ask you, too, is like we hear elbow injury and we always just kind of think about the bending process of the elbow, right? But when you think about pass protection, you've often got your arms out in front of you, extended and locked outward. Is that something that is going to be very painful for him, or is it more about the bending?
It will be quite painful. It is about the bending, but trying to straighten that. Pat, when you went back to the gym for the first time ever and tried it that one time, you tried to do your bicep curls, you know what you felt like the next day.
It didn't go well.
You don't want to straighten it. Doesn't go well. So it's kind of similar to that, but don't want to dumb it down too much for poor Donovan. But, yeah, he's going to have some tenderness when he straightens that bad boy out.
Hey, really quickly, Doctor, we actually have a question on the Bartow Ford DAE text line. Somebody wants to know your thoughts on rooster comb injections for the knee cushion. Is that something you're familiar with?
Oh, rooster comb, affectionately called, roosters are cock gel. It is a nice injection that we love to do for painful arthritic knees. So, someone like me or somebody else who would like to just experience a little bit of chicken.
See, I didn't read that text because I thought somebody was messing with us. I was like, is somebody messing with us? I forget we actually have listeners that have real questions for you. We've seen them before. So we'll incorporate that in the future. We'll get. That's
really awesome. It's actually hyaluronic acid derived from rooster comb. And it's really funny to hear people in the gym or out in the community say, yeah, I got that chicken gizzard injection. And I'm like, no, it's the cock gel from the rooster.
What is a rooster comb, by the way? I don't even know what that is.
That's that little floppy thing on the top of their head.
Oh, really?
Little pink.
And they shoot that. You shoot that into a knee.
It's derived. Yeah.
Interesting.
Some of the substance derived from in there, and it actually mimics a healthy knee joint, so it lubricates the knee.
Dr. Sellman knows it all, and that's why we love having him on. We love having everyone on involved with the Florida Orthopaedic Institute and Tampa General Hospital. The Pat and Aaron Show Injury Report presented by Tampa General Hospital in partnership with Florida Orthopaedic Institute, providing you access to one of the top orthopedic programs in the nation. Schedule your appointment today at FloridaOrtho.com. Kneecap slides, elbow pits. Thank you for all of it, Dr. Sellman.
Oh, anytime, guys.
We'll talk to you soon.
Thanks, Doc.
He is the best. Dr. Sellman and everyone over there. Dr. Sellman even said it himself, right? Multiple opinions. They're not going to say, you're not going to go to Florida Orthopedic Institute in partnership with Tampa General Hospital, and they're not going to tell you, hey, this is the end. We're the ones. We're the answer. This is the last opinion, the only opinion. They're going to tell you, listen, get some other opinions. They're going to be honest with you. Whatever injury you're dealing with, they're going to make sure there's a solution for you. However, they have to get to that solution.
Yeah, and if you got a young athlete or if you're just an athlete, you're that weekend warrior Dr. Sellman was talking about, they have the largest and most advanced sports medicine program in the region. They also have the most advanced treatment for sports-related injuries. So, again, anything you're dealing with, a lot of times we tell them kind of some of the questions that are coming, but we just pulled the rooster comb question right off the text line. Doctor knew exactly what we were talking about because they really are dialed in at Florida Orthopedic Institute and Tampa General Hospital. So, for access to world-class orthopedic care right here in your own backyard, all you have to do, call 1-800-FL-ORTHO or go to FloridaOrtho.com.